Hello friends, welcome to Gyan's Academy. The organ we are talking about today is the spleen. Let's dive into its details. Hello friends, welcome to Gyan's Academy. The organ we are talking about today is the spleen. The spleen is located in the left upper quadrant of the abdomen, just beneath the diaphragm and behind the stomach. It's protected by the left lower ribs. In terms of size and shape, the spleen is about the size of a fist, typically around 12 cm long, and has an oval or crescent shape. Now, let's talk about the spleen structure. First, we have the capsule. The spleen is surrounded by thin, fibrous outer layer called the capsule, which serves as a protective barrier. This capsule isn't just for protection, it also contains smooth muscle fibers. These fibers are capable of contracting, which allows the spleen to expel blood when needed, helping regulate blood flow. Next, let's talk about the red pulp. The red pulp plays a crucial role in filtering the blood. It contains blood vessels and macrophages, which are specialized cells that help remove old or damaged red blood cells. This process is essential for maintaining healthy blood circulation and recycling important components like iron. The red pulp is key in keeping the blood clean and free of unwanted cells. The vascular sinusoids are an important part of the spleen's structure. These are specialized blood vessels found in the red pulp of the spleen. They have a unique structure, with large, irregularly shaped spaces that allow blood cells to pass through easily. The sinusoids act like filters, enabling the spleen to remove old or damaged red blood cells and other debris from the blood. The walls of these sinusoids are lined with endothelial cells and macrophages, which help with the process of blood filtration and immune surveillance, supporting the spleen's role in both blood cleansing and immune function. Next is white pulp. The white pulp is made up of lymphoid tissue, which is essential for the body's immune function. It houses T cells and B cells, two types of white blood cells that play a key role in defending the body against infections. The white pulp helps identify and fight pathogens, ensuring the body stays protected. Next, we have the trabeculae. The trabeculae are strands of connective tissue that provide important structural support to the spleen. They help maintain the spleen's shape and integrity, ensuring it functions properly. These connective tissue strands play a vital role in keeping the spleen stable and resilient. Now, let's explore the physiology of the spleen. The spleen plays a crucial role in filtering out old or damaged red blood cells. It also recycles iron from hemoglobin, ensuring that the blood remains healthy and efficient. This process helps maintain a steady supply of healthy red blood cells for oxygen transport throughout the body. Next, let's talk about the immune function of the spleen. The spleen plays a critical role in the immune system by constantly monitoring the blood for pathogens. It activates immune cells like T cells and B cells, which are key in fighting off infections. The spleen also produces antibodies and stores white blood cells for later use, ensuring the body can quickly respond to any infections or threats. Next, let's talk about the immune function of the spleen. The spleen plays a critical role in the immune system by constantly monitoring the blood for pathogens. It activates immune cells like T cells and B cells, which are key in fighting off infections. The spleen also produces antibodies and stores white blood cells for later use, ensuring the body can quickly respond to any infections or threats. Next, function is blood storage. The spleen acts as a blood reservoir, storing platelets and red blood cells. These can be released into circulation when needed, such as during blood loss or physical exertion, helping to maintain proper blood volume and ensure the body has enough blood cells to function effectively. The spleen plays a key role in removing old platelets from the bloodstream. This process helps regulate the platelet count in the body, ensuring that the blood has the right amount of platelets for proper clotting and overall health. Lastly, let's talk about how the spleen helps with hemoglobin breakdown. The spleen breaks down hemoglobin from old red blood cells, recycling the iron for future use. The leftover components are converted into bilirubin, which is then excreted in bile. This process ensures the efficient recycling of valuable resources and helps keep the body's waste management system running smoothly. The spleen plays a vital role in overall health, and any dysfunction can lead to significant clinical issues. Let's discuss some important clinical conditions related to the spleen. Splenomegaly is when the spleen becomes enlarged, often due to infections or blood disorders. A significantly enlarged spleen may be palpated during physical exam, signaling need for further investigation. As a nurse, it's important to recognize the key symptoms of splenomegaly. Pain or fullness in the left upper abdomen. Patients may report discomfort or a feeling of fullness in the left upper quadrant, where the spleen is located. Feeling full after small meals. Patients might experience a sense of fullness even after eating small amounts of food, which is a common sign of splenomegaly. Fatigue or weakness. Due to the spleen's role in blood filtration, fatigue or weakness can occur as a result of anemia or the body's struggle to maintain energy levels. Anemia, excessive destruction of red blood cells by an enlarged spleen, can lead to anemia, manifesting as pale skin, dizziness, or shortness of breath. Increased risk of infections. An enlarged spleen can compromise the immune system, leading to a higher risk of infections. Treatment depends on the underlying cause of splenomegaly, such as infections, liver disease, or blood disorders. Antibiotics may be prescribed for infections, while blood transfusions are used for anemia. In more severe cases, splenectomy means removal of the spleen may be necessary. Splenectomy is the surgical removal of the spleen. This procedure is often performed when the spleen is damaged due to trauma, disease, or conditions such as splenomegaly, enlarged spleen, hypersplenism, or blood disorders, like autoimmune hemolytic anemia or certain cancers. After splenectomy surgery, nursing care is crucial for a smooth recovery. Let's go over the key points you need to keep in mind when caring for a patient post-surgery. After a splenectomy, patients are at increased risk for infections, particularly from bacterial infections like pneumonia, meningitis, and sepsis. Ensure the patient is up to date with vaccinations, pneumococcal, meningococcal, and Haemophilus influenzae vaccines before surgery or as soon as possible after surgery. Administer prophylactic antibiotics as prescribed. Watch for symptoms such as fever, chills, or increased heart rate, which may indicate an infection. Educate the patient on the importance of early detection of infections and seek prompt medical care if symptoms arise. Monitor for signs of bleeding post-surgery, as the spleen is highly vascular. Check for hypotension, tachycardia, or external bleeding. Assess the surgical site for any signs of infection or excessive bleeding. Provide appropriate pain relief following surgery, including medications as prescribed. Use non-pharmacologic techniques like positioning and heat-cold therapy to help manage discomfort. Educate the patient on the importance of infection prevention due to the loss of the spleen. Advise them on the need for vaccinations and antibiotic prophylaxis before future medical or dental procedures. Discuss lifestyle changes to support their immune system, including good hygiene practices and avoiding exposure to illness when possible. Schedule regular follow-up appointments to monitor the patient's health, focusing on infection prevention and overall immune function. Discuss any signs or symptoms that should prompt immediate medical attention, such as fever or persistent infections. Another clinical problem associated with the spleen is hypersplenism. Hypersplenism is a condition where the spleen is overactive, leading to the excessive destruction of blood cells, including red blood cells, white blood cells, and platelets. Common causes hypersplenism include infections, liver disease, blood disorders like anemia or leukemia, and conditions like cirrhosis or sarcoidosis. Signs and symptoms includes: fatigue is due to anemia. Frequent infections is caused by a low white blood cell count. Easy bruising or bleeding because of low platelet count. Left upper abdomen pain is due to an enlarged spleen. Treatment of hypersplenism is: treat underlying causes like infections or any blood disorders. Splenectomy may be necessary in severe cases. Medications to boost blood cell counts or manage conditions. Last but not least, another problem of is spleen rupture. Let's look at the causes, signs and symptoms, and treatment of spleen rupture. Spleen rupture occurs when the spleen is torn or ruptured, usually due to trauma, resulting in internal bleeding and a medical emergency. Causes of spleen rupture includes: blunt trauma is very common in car accidents, sports injuries, or falls. Penetrating trauma due to stab wounds or gunshot wounds to the abdomen. Underlying conditions, like enlarged spleen due to infections or blood disorders, can increase the risk of rupture. Signs and symptoms you may observe in your patients are severe and sudden pain in the left upper abdomen. Shoulder pain will be referred pain due to irritation of the diaphragm, and this is known as Kehr's sign. Hypotension and tachycardia are symptoms of shock caused by internal bleeding. Bruising or swelling in the abdomen, and dizziness or fainting due to blood loss. Treatment of spleen rupture includes immediate medical attention is required, as spleen rupture is a surgical emergency. Conservative management is implemented when bleeding is controlled and the spleen is not severely damaged. Treatment may include rest, blood transfusions, and close monitoring. If the rupture is severe, surgical removal of the spleen may be necessary. Supportive care includes administering fluids, oxygen, and blood products as needed. In summary, the spleen plays a vital role in filtering blood, supporting the immune system, and storing blood components, and understanding its function is crucial for providing effective care. Thanks for watching. Stay tuned for more videos like this, and don't forget to like, share, and subscribe to our channel.